let's continue on with our discussion on the autonomic nervous system. First of all, when we're discussing the autonomic nervous system, which two divisions are we talking about? And sympathetic. Do you have to worry about visceral sensory at all? No. No, I did not. I did not at all address visceral sensory. I said our focus on visceral systems will be on motor. That means output commands. And we will focus on the sympathetic and parasympathetic division. When we left off, I told you where you can find the preganglionic neurons for the sympathetic and parasympathetic division. And I told you their alternative names, which are based on where you can find their first cell bodies. So, why is the sympathetic nervous system called thoracolumbar?
Because we go from T1 to L2.
T1 to L2. I'm sorry, see?
I just said it ends in lumbar.
Okay, it does end in lumbar, that's for sure. Where are the cell bodies found specifically in T1 through L2?
Ganglion.
Not in ganglion. All of the cell bodies for the first neuron in the two neuron chain are always found in the CNS. So where are they found for the sympathetic nervous system? You said T1 through L2, but where exactly are they found? What is their address?
Ganglion.
It wasn't right the first time, so it doesn't make it right the second time. Now, honey, now, it is a lateral gray column with a very specific name for T1 through L2. Intermedial lateral cell column, IMLCC. Where are the cell bodies found for the first neuron for the parasympathetic division? It's called craniosacral for a reason. SLGC, SGLC, SLGC, sacral lateral gray column, S2, S3, S4, but where else? That's right, cranial nuclei for cranial nerves 3, 7, 9, and 10. Okay. We have a two neuron chain. The first neuron has to synapse on the second neuron. The second neuron, the neuronal cell bodies are also found in very specific regions. They are different for the sympathetic division and they are different for the parasympathetic division. Parasympathetic division, they are found in ganglia called terminal ganglia. And last week I told you they are found in the wall of the involuntary effector. Specifically, I said, as an example, if you think about the heart, there's the epicardium, myocardium, and endocardium. And I said in between the epicardium and the myocardium, you would find the terminal ganglia. Okay. Where would you find the sympathetic ganglia? This is a picture of one of them. Okay, I'm going to go on record publicly. I am going to eat you all up and spit you out alive. You all are focusing on lab exam 3, which is awesome and good, and that's awesome. That is super good. You need to catch up. So consider this week your last-ditch effort to catch up. Sympathetic ganglia are found in either para or prevertebral ganglia. Paravertebral ganglia. Para means next to, pre means before. Paravertebral ganglia are shown here in this picture. These are the sympathetic ganglia that are next to the vertebral column. They are part of the sympathetic trunk. Prevertebral ganglia are found on major blood vessels in the abdominal cavity. They are also called collaborative. That is not what I meant. Collateral ganglia, and they have specific names when they are on the blood vessels of the abdominal cavity. Celiac ganglion, superior mesenteric ganglion, and inferior mesenteric ganglion. Thursday, you have a quiz on chapter 17, which deals with pathways. And that's what we're dealing with today and on Thursday. It's all about pathways and routing the preganglionic fiber, the postganglionic fiber for the ANS, and for the pathways in chapter 17, sensory incoming systems and motor efferent systems. Okay. Pathways. There are options for the preganglionic fiber and the postganglionic fiber. The preganglionic fiber and postganglionic fiber and their options depend on which system we're talking about at any given time. We're going to start out with the sympathetic nervous system. And I'm going to start out with the options for the postganglionic fiber for the sympathetic nervous system. It's more limited. So I'm going to start out with that one. Again, we're starting out with the second neuron and its options. How can it get to its involuntary effector? These options that I'm going to go through for the preganglionic fiber and postganglionic fiber will have different terms in your textbook. They might say at level, up or down, thoracic viscera, collateral ganglion, or adrenal medulla. Again, I'm starting out with the postganglionic fiber option. There are two. The postganglionic fiber, the cell body can be in a sympathetic ganglion of the sympathetic trunk. The axon can exit through what I call the back door. This back door option will go to thoracic viscera, heart, lungs. Those are the viscera in your thoracic cavity. Another option is that the postganglionic neuron can be in one of the three prevertebral ganglia: celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion. And that postganglionic fiber will synapse to involuntary effectors found in the abdominal cavity. So those are the two options. I can either exit through the posterior wall to get to thoracic viscera, or I can synapse on the prevertebral ganglion to get to abdominal viscera. Those two options are for viscera internally, thoracic or abdominal. Those are not the options for viscera in your body wall, in your skin. So you're going to have to pay attention to that very rare exception. These two are for viscera in your core. I have yet to address viscera that are in your body wall. And there's a reason why I have to keep them separate. Your body wall viscera have different embryonic origins compared to your thoracic and abdominal viscera. Another issue that we have is with the adrenal medulla. It is an extension of the sympathetic nervous system. The adrenal medulla is encapsulated by the adrenal cortex. These have two different embryonic origins. The adrenal medulla is nervous system derived. The preganglionic fiber will synapse directly on the cells of the adrenal medulla. You might think that I'm breaking the 2-neuron rule chain. That is not true. The cells in the adrenal medulla are called chromaffin cells. They are modified postganglionic cells. When they release their neurotransmitter, they release it into the bloodstream, and therefore it is a hormone. So it might look like it is an exception. It is not. There is still a 2-neuron chain. Sympathetic and parasympathetic division. Both of them follow a 2-neuron chain. When are they active? They are active all the time. The question is better asked if I say which one is more in charge. Right now, resting and digesting, that would be parasympathetic nervous system. Fight, flight, freeze, fornicate response, that's your sympathetic nervous system. Given the blank stares that I'm getting right now, you all are in big trouble. By the time you're ready to focus on this unit, it will be too late. And it should be the opportunity for you to get big points on an exam. It's very clear as day in your homework packet, and I don't see evidence that any of you are really working on that. Probably because you all think, oh, Lab Unit 3 exam is before Lecture Unit 3. You have my warning. They are active all the time. Better question is, when is one more active than the other? The length of the pre- and postganglionic nerve. They are inversely related. The preganglionic neuron for the parasympathetic division is very long. The postganglionic neuron is very short. For the sympathetic division, the preganglionic nerve is very short, and the postganglionic nerve is very long. Where do we find the locations of the preganglionic cells? I've done this now at least 4 times. Craniosacral and origin for the parasympathetic division, nuclei in the brain for cranial nerves 3, 7, 9, and 10. Sacrolateral gray column, sacral equivalents S2, S3, S4. That's where you will find the preganglionic neuronal cell bodies. Sympathetic division, thoracolumbar in origin, T1 through L2, intermediolateral cell column. That is a lateral gray column found at the levels of T1 through L2. Where do you find their postganglionic neuronal cell bodies? Parasympathetic division, terminal ganglia in the wall of the involuntary effector. Sympathetic division, they are found in discrete locations. They are either found in prevertebral ganglia or paravertebral. Paravertebral are the sympathetic ganglia of the sympathetic trunk. Prevertebral are also called collateral. They are found in the abdominal cavity on top of major blood vessels. Celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion. What neurotransmitters do they release? The preganglionic neuron, as you saw last week, always releases acetylcholine. What about the postganglionic neuron? For the parasympathetic division, I said, what are the first 2 vowels? In the word parasympathetic, you all said A and A, and I said acetylcholine, acetylcholine. Those are the neurotransmitters released by the 2 neurons of the parasympathetic division. For the sympathetic division, I said A, E, I, O, U, sometimes Y. Let's pretend that Y is not a vowel. Then what are the 2 first vowels in the word sympathetic? You all said A and E. A for acetylcholine, E for epinephrine, also known as adrenaline. No, adrenaline. Noradrenaline, norepinephrine are the same. Adrenaline and epinephrine are the same. They chemically are different. So noradrenaline and adrenaline are different. Norepinephrine, epinephrine are different. But for anatomy, you have license to consider all of those the same. When you get to physiology, they are not the same. When you get to pharmacology, they are most certainly not the same. So again, we are in the sympathetic division. We're going to go through options of the preganglionic fiber. Last week I said, do you have more than one way to get home? You all said yes. And I said, okay. When we start memorizing our pathways, it's all about how can you get to your destination. When we're talking about the autonomic nervous system, we have to use a 2-neuron chain. So we have to have a pathway for the first neuron, we have to have a pathway for the second. And they both have backups. In case one pathway is blocked, we've got a backup. So let's now look at the options for the preganglionic neuron for the sympathetic division. I just reviewed the options for the postganglionic neuron for the sympathetic division, getting to viscera in the thoracic and abdominal cavities. The option for the preganglionic fiber is cell body is in the intermedial lateral cell column at levels T1 through L2. It exits through a ventral rootlet, enters a ventral root, travels for a short time in a spinal nerve, enters an anterior primary ramus, and enters a white communicating ramus. When something is white versus gray, what does that mean?
Myelinated.
So the white, notice that the white is way over here. It's more lateral than the gray. This is the incoming door. We talked about last week restaurants, how they have double hinge doors leading to the kitchen. Wait staff enter the kitchen through one door and they exit through a different one. It's really important that they adhere to that. The nervous system is no different. Something coming in and something leaving must enter and exit through different doors, different rami. That means branch. Think branch, think door. So the incoming door is not the first one like you would anticipate. It's more lateral, which is weird, but that's how it grew. So the white ramus is used for the incoming preganglionic fiber. It will, this is one option, it can synapse in a sympathetic ganglion of the sympathetic trunk. That's a paravertebral ganglion. It can synapse right there at that level. How can you think of that? Okay. How many of you came in to this building at this level? I did not. So 2 of you, how many came in at this level? At this level, that means you use the ramp over there. That's what it means to me. There is no other way to come in on this level unless you used that ramp over there. Is that right? That's what you used. Did you?
Or the stairs?
No, then you did not come in on this level. You entered on a different level and then you took the stairs up.
Little stairs outside. Oh.
I'm saying entered on the, come on my loves. Field trip, come on.
There's a bridge. It's a pedestrian walkway that goes straight up to the
Oh, yeah.
I am. My dad works in Amsterdam. Really? Yeah. Not right now, no. You centric? Yeah.
So the preganglionic fiber enters the sympathetic trunk at level. At level. Now, some of you said you entered at level. Some of you said you entered at different levels. Okay, then that means when you leave at the end of the day, you have to go to your car. That means you either have to go up or down to get to the level, the parking lot, where your car is. If you enter today at level, then your car is relatively at level, correct? So who were the two people that entered at level? Where did you park?
I did not park in
Okay, so you did not park, you just came walking down.
It was in the
Student services is third level. So you came down.
But I took that
But
door.
So if you came from student services, you came from the third level and you took the ramp down. Didn't you? No one directly entered from that door from the parking lot right outside of the library, did they? Did anyone? So you were either above or you were below. Okay, so at level, enter. You might leave tonight either going up to the third floor, out to your car, or down to the first floor, down to your car. That's going to be the second neuron option, how you exit the sympathetic trunk. Right now we're talking about how do you enter the sympathetic trunk. You always enter at level. There is no option for this neuron to send an axon up and then enter. They always enter at level. If your class is on the second floor of the science building, you enter at the second floor. That means you all park in that parking lot right out there by the library, and you enter at the second floor ramp. You do not come down, you do not go up. You enter at that level. Clear? Okay. Now, you have to enter at the level where you parked at. But once you enter this building, could you go up or could you go down, which is what you all described. Some of you came into this building, you went up a level or you went down a level. Cynthia, you came from the Student Service Center. You entered the ramp. You went down a level before you entered that bridgeway, okay? But you did not park in the parking lot by the library where you can come in at level. You had to come down. So, you come in at level, then you can either go up or you can go down. That's how most of you got to this building, to this classroom. You either went down a level to get to me or you came up a level to get to me. But you entered the stairwells or the ramps at the level you were at. Agreed? So Cynthia, you came into this building on the third level. Then you chose to come down to the second. Brandon, you parked lower level, you came to the stairwell, and you went up to the second level. Am I hearing you right? Did you do that? Where did you park, my love?
I parked here, right down here, and I went up to the student services, and then I went down a level in here.
Anybody else enjoying my frustration right now? What are you hearing? Where did you park, my dear?
In the parking lot below. Yeah.
Where? By the tennis courts? Mm-hmm. So you walked across the street from the tennis courts up to where?
Up to the student services center.
So you went up 3 levels before you crossed a bridge, and then you came back from the student center across a bridge and down a level to me? Mm-hmm. Okay.
Glad we got that straight.
Wherever you park, That's where you had to enter. Did you have options to go up or down? Yes, you did. But you have to enter at level wherever you were, and then you can sprawl up or down. That is an option for the preganglionic fiber. You can either enter at level and stay at level, which none of you did today, or you can enter at a level and go up or down as necessary. Those are the options for the preganglionic fiber. Again, most of the time I park at level. I finish my day in room 227. That's right by the bridge that we had our field trip just now to. I park right out there by the library. I come in at level, I exit at level. There is no up or down for me. It's easy. And when I'm schlepping all my bags, I don't want to have to go up or down. Most of you are telling me you parked either higher or lower. You came in on bridges or footwork, ramps at level, and then you either went up or down and went to your classes. Agreed? Okay. Now here's another option for the preganglionic fiber. It enters at level through the white communicating ramus. It doesn't have to go up or down. It doesn't have to exit through a gray ramus. It can enter a splanchnic nerve, and the definition of a splanchnic nerve means it is a nerve, a collection of axons outside of the central nervous system, and it is a collection specifically of preganglionic fibers. So they're going to break through the back door and go to a collateral ganglion. One of the three found in your abdominal cavity that I just highlighted: celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion. Enter at level, break through the sympathetic trunk, and go to a collateral, also known as prevertebral ganglion. Celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion. Another option, enter at level, break through the sympathetic trunk, and go straight to the adrenal glands and synapse on the adrenal medulla. It looks like we're violating the 2-neuron chain, but we're not. The adrenal medulla is actually modified postganglionic neurons. They will release epinephrine into the bloodstream. What about the options for the postganglionic fiber? Pink is preganglionic fiber, blue is postganglionic fiber. Here's the pink. This is me. I park out by the library most of the time. I enter at level. I will exit at level. That is one option for the postganglionic fiber, to exit at level. Postganglionic fibers have to exit through, for this option, through the gray ramus, which means it's not myelinated. It can enter an anterior primary ramus, as shown here, or it can enter a posterior primary ramus. That means it's going to target involuntary effectors, either ventral or posteriorly of the spinal cord. An option for the preganglionic fiber, like Brandon, he entered campus on one level. He went up or down to a different level of this building. And now we have a postganglionic fiber exiting through a gray ramus and can enter either an anterior primary ramus or a posterior. And again, serve involuntary effectors of the body wall, either anterior or posterior of the vertebral column. Postganglionic fiber can also exit from a prevertebral ganglion, celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion, and go to the viscera of the abdominal pelvic cavity. That would be your intestines, your stomach, your pancreas, anything that's involuntary in your abdominal pelvic cavity. Another option for the postganglionic fiber, going to the lungs or the heart. Again, the preganglionic fiber enters at level, synapses in a sympathetic ganglion of the sympathetic trunk at that level, exits through the back wall, does not take a splanchnic nerve, does not go out the gray ramus, communicating ramus. Instead, it goes right out to the thoracic viscera, which would be the heart and the lungs. I would ask at this point, do you all have that? But I know you don't. Most of you are not even paying attention. Then I'm going to say, look at your homework packet, and next time I see you on Thursday, I would hope that you have questions. You really need to pay attention to your homework packet. And I can tell that many of you are not paying attention to it yet. Probably because lecture unit 3 is how many weeks away? 2. So you've been memorizing all of your blood vessels, the valves of the heart. You've been memorizing the parts of the sheep brain, the sheep eye, the parts of the ear, which is all very good. But if you wait until the weekend of this test, you will not have opportunities to ask me questions. Are you ready for parasympathetic division and their options? Because here we go. This is another picture that you have likely seen in your homework packet, not just of the spinal cord with the options going up or down, because the sympathetic trunk only applies to the sympathetic division. Parasympathetic is craniosacral. There is none of this up or down business. It's actually a lot more simple when you compare it to the sympathetic division. When you are tested on the parasympathetic division, I will use this picture and I will say to you, you are at a certain level. Some parts of this picture apply at this level, others do not. Cross off the parts of the picture that do not apply. If you cross them off, then don't use them. If you actually draw a pathway through something you've crossed out, then that tells me you have no idea what you're doing. Parasympathetic division, craniosacral, 3, 7, 9, and 10 nuclei off of the brain. Sacral equivalents at S2, S3, S4, specifically the lateral gray column called the sacral lateral gray column. What are the options? For the sacral lateral gray column, they come off of the sacral lateral gray column. They will exit through a ventral root, enter a ventral root, then they will enter a pelvic splanchnic nerve, then they will synapse on postganglionic neurons that are found in the visceral wall. Terminal ganglia, found in the involuntary effectors wall. Very close to the involuntary effector, smooth muscle, cardiac muscle, or glands. Look how close those neuronal cell bodies are to the smooth muscle of your detrusor muscle of your bladder. For cranial nerves 3, 7, 9, and 10, they would come off a nuclei off the brain, and they would terminate again on terminal ganglia near the involuntary effector. Cranial nerve 3 will communicate to cranial nerve 3 will communicate to a postganglionic neuron that will target the ciliary body, your intrinsic muscles of your iris, your vascular tunic. 7, cranial nerve 7 will synapse on a postganglionic neuron that will innervate your lacrimal gland and your submandibular glands and sublingual. Cranial nerve 9 will synapse on a postganglionic neuron that will terminate on your parotid gland. And cranial nerve 10 will synapse on a postganglionic neuron that will innervate your heart, your lungs, and the smooth muscle of your abdominal organs. Up until the left colic flexure. See, you have your stomach, your small intestine, duodenum, jejunum, ileum, leads to your large intestine, ascending colon, transverse colon, and the curvature from the ascending to the transverse, that's called your right colic flexure. Anything from the left colic flexure, which is your transverse colon, to your descending colon, over to approximately your appendix over here, all of this is innervated by cranial nerve 10 with its postganglionic partner. Anything from the left colic flexure down comes from the sacral equivalents, S2, S3, S4, and their postganglionic partner, getting the descending colon, sigmoid colon, rectum, anus, anything in the pelvic bowl, bladder, for example. So anything from the left colic flexure up, you should be thinking cranial nerves. Anything from the left colic flexure to the appendix down this quadrant, you should be thinking sacral equivalents, S2, S3, S4. Pathways. Pathways, parasympathetic pathways. To the heart, to the viscera of the abdominal and thoracic cavity, versus the viscera that are below the left colic flexure. You are seeing here in red cranial nerve number 10, the preganglionic neuron. It will synapse on a postganglionic neuron in the wall of the involuntary effector, shown here at the heart. The terminal ganglia are found in between the epicardium and the myocardium. Heart rate would slow down. I could show a similar drawing showing how it synapses to the smooth muscle of the lungs to constrict the air passageways of the lungs, limiting airflow. If I want increased gut motility, I need the vagus nerve to synapse on a postganglionic neuron that will be found in the wall of the involuntary effectors of your viscera in your abdominal cavity ahead of the left colic flexure to increase gut motility, resting and digesting. If I want to target involuntary effectors beyond the left colic flexure, down here, left colic flexure to the appendix approximately, then I would need pelvic splanchnic nerves from S2, S3, S4, pelvic splanchnic nerve, and it will terminate on a postganglionic neuron in the wall of the involuntary effector, and I would have increased gut motility of my descending colon, my sigmoid colon, my rectum, and my anus, as well as my bladder. Here is another reflex arc, 2 different reflex arcs that are found in your homework packet and will be tested upon. How many of you have taken a CPR class? Good. Tell me, where do you look for someone's pulse? I'm on the floor. Where are you going to look for my pulse? And if you can't find it right away, what are you going to start doing? You can't find my pulse. Someone says, do you feel her pulse? And you're like, I don't feel it. What do you start doing? Freaking out? You probably start pushing harder. The more you push, the worse you are making it for me. Can you feel your pulse right now? You're calm right now. You're not rushing on to someone, worrying about them. They're unconscious. You're calm right now. And you are calmly touching your carotid artery, and you can feel your pulse. Do you feel it? You don't have to push very hard, do you? But in the heat of the moment, you start pushing real hard. And that's where you're no longer helpful to me. You see, in your aortic arch and in your carotid sinus, right here, you have modified nerve endings called baroreceptors. And being nerves, they respond to stimuli. You know this from lecture unit 2. The more that a nerve is going beyond threshold, the more it will fire action potentials. The bullet can fire more than one time, but it cannot fire with more force. When you shoot a gun, it shoots the bullet with the same force. So these baroreceptors detect pressure. The more pressure they detect, the more action potentials they fire, just like a neuron should. More stimulus, more firing. They send the information up to your central nervous system where integration occurs. There are 5 parts of a reflex arc. I've already taught you this. One of them, number 3, is integration. The baroreceptors send information up to your medulla oblongata, part of your brainstem, about the pressure they are receiving in the aortic arch and your carotid sinuses. The more pressure, the more action potentials they fire. And the medulla oblongata is going, man, too much pressure. And the resulting output to the heart and to your vasculature is, we need to be more calm blue ocean. Heart rate goes down. Your blood vessels vasodilate. We're under too much stimulant. We need to be calm. And if you find me unconscious and you start pushing around in the heat of the moment, going, I can't find it. Pulse. What is my brain going to say to my heart? Because it doesn't care where the pressure's coming from. It doesn't care if it's coming from inside the vessel or you pushing on the outside. What is my brain going to say to my heart as you push on my carotid artery, trying to find my pulse in an effort to help me? You are not helping me at that point. Do you understand? Because the more you push, the more my brain is going, too much pressure. Resulting output, calm blue ocean. And my heart rate and force of contraction go down. You are not helping me. You're making things worse. I am most certainly not getting enough blood perfusion at this point because my heart's going, we should relax more and not eject as much blood. You are hurting me, not helping me. Did you ever watch Star Trek? And I'm talking old school Star Trek. What was the technique that Mr. Spock would use? He'd push in their neck, wouldn't he? And they'd go, baroreceptors. He'd push on them. Resulting output from the brain to the heart was, you need to go calm blue ocean, and the person would pass out. Baroreceptor reflex arc. You have a patient with elevated heart rate. What can the doctor do? Carotid massage. Push on it. More pressure. More stimuli up to the brain. Medulla oblongata is going to get all those action potentials and process them, and the resulting output, if there's too much pressure, will be parasympathetic. But if there's not enough pressure, it will be sympathetic. Not enough pressure, I need sympathetic. Increased heart rate, increased force of contraction. You need to know this baroreceptor reflex arc. On the board right now, what would happen if you don't have enough pressure? Have you ever felt lightheaded and faint? Why was that scary? Because you did feel fear. You did have fear. You feel yourself feeling cold and clammy. You can feel the blood leaving your skin, and you feel panicked. Why do you think you felt panicked? Reduced blood pressure, baroreceptors sent fewer action potentials. The resulting output from the brain was, oh my gosh! We need to pick things! Ah! And your heart rate started going up and you felt, that's why you felt fear. It was a sympathetic moment that was being provoked from you. It's the worst feeling, isn't it? Have you ever been in a situation where you felt like, I'm going down hard, and you were terrified because of where you were and creating a scene, and you were like, why do I care? Because your sympathetic output was raging through the roof. And so everything in your brain was like, you can't do this right now. You can't do this right now. What are you doing? You can't do this. And it made it worse, didn't it? You were having a sympathetic moment. Your brain was trying to tell your heart, you lazy son of a bitch, pick it up, let's go! And your heart's like, I'm trying, really am trying, but I just can't. She didn't drink enough water. She had all this caffeine and she drank too much the night before. She's really dehydrated. I can't do all this. And your brain's like, I don't care! And you feel, and then you can feel your heart beating, can't it? And you hear the sound and and you start to feel flushed. It's the worst, isn't it? And if you overwhelm that system too much, it will shut down completely, and then all you have left is parasympathetic, which means the vagus nerve is like, wait, I have control, let's take a nap, and you hit the floor. And that's why you faint. This is called a vasovagal response. You asked me about that, Caitlin, last week. It's all about baroreceptors. Which division should gain control, which craps out if you overwhelm it, and which one is like, yay, I have control now. And those are your patients that faint on you. Getting your blood drawn, who likes that? I do not. I do not like getting I have to get my blood drawn for my students in physiology every semester. I hate it. And I have students on either side of me holding my head, and I have a student of mine, past student, he comes and he draws my blood. You want to know why? Because I've been told by the nurse's office over there in the student health service that I can't go back because I faint on them and I'm too much work. So my past student, Farouk, he comes and he draws my blood. He's super good. He keeps me calm. And then I have students on either side of me holding my head, fanning me. And then it takes me about an hour to recover from that because I have to get like 5+ tubes for all 10 to 11 sections of phys. That's a lot of blood. And I don't like it. Baroreceptor reflex arc. If you have decreased pressure, decreased firing from baroreceptors, which division should commandeer your body? Sympathetic. Bring the pressure back up. If you have too much pressure, which division should gain control? Parasympathetic, and you should reduce the force of heart contraction and the number of beats. Get out your homework packet.